That's not a story I made up. That's a real pattern. Thousands of people who are fully qualified, smart, and motivated, getting completely shut out of MedTech. And here's what makes this even more frustrating. MedTech is not just growing, it is booming. The industry is hiring, the jobs exist, and yet qualified people are still getting shut out. So here's the question nobody can answer. Why are so many smart people still getting ignored? And here's what I'm going to do. I'm going to show you exactly why. And more importantly, how to get on the right side of that wall. What you're going to walk away with today? A clear, step-by-step picture of how hiring in this industry actually works. Not the LinkedIn advice version, the real version. And here's what we're covering. The 3 mistakes that sink most applicants before their resume even gets read. How to position yourself whether you're a new grad, coming from pharma, or pivoting from something completely different. And the one thing that separates candidates who get called back from candidates who get ghosted. Most people miss this completely. So stay with me because the third point is the one most people skip, and it's the actual unlock. Here's the first place people go wrong. They treat MedTech like it's just another job hunt. They apply on Indeed. They send their resume. They use the same cover letter they used for their last 3 applications. And they wait. The reality is this. MedTech does not work that way. Here's what that means for you. When you apply cold, no context, no connection, no signal that you understand what this industry actually cares about, you are invisible. Full stop. So what do they actually care about? 3 things. Number 1, regulatory awareness. Number 2, commercial acumen. And the third thing, clinical fluency. You don't need to be an expert in all 3, but you need to speak the language even at a basic level, or the door doesn't open. This is where it gets specific, because the strategy looks different depending on your starting point. If you're a new grad, listen carefully. Your biggest asset is not your GPA. Here's what actually moves the needle. Pick a therapeutic area. Cardiology, orthopedics, neurology, doesn't matter which. Pick one and actually learn it. Read white papers. Follow the key companies. Know the competitive landscape. Picture this. You walk into an interview and talk about a specific product category with actual substance. You immediately stand out from the stack of resumes that just say passionate about healthcare. If you're coming from pharma, here's the truth. You're closer than you think. But you have a perception problem to solve. One move fixes it. Reference the differences in your cover letter. Acknowledge the shift. Show you've done the homework. That single move separates the candidates who get screened out from the ones who get a call. And if you're pivoting from something completely outside of healthcare, here's what's important. Don't hide from it. Use it. Most people get this wrong. Your story is not a liability. It's a differentiator. But you have to connect the dots yourself. Don't make the recruiter do that work. Okay, I told you there was a third thing. Here it is. Evidence. And here's what I mean. Not your resume. Not your LinkedIn profile. Actual evidence that you can do the job before you have the job. It doesn't have to be perfect. It doesn't have to be published anywhere. But when you can email a hiring manager and say, I put together a brief analysis on your transcatheter aortic valve space. Happy to share it if it's useful. That is a completely different conversation. Think about what that means. You're not just another applicant at that point. You're a person with a perspective. And in a relationship-driven industry like MedTech, that changes everything. There's one more piece to this, and I can't stress it enough. Warm outreach, not spam. Not copy-paste LinkedIn messages. Actually find people who work at the companies you want to work for and ask them smart questions. Questions that show you've already done the research. The goal is not to ask for a job. It's to become a name they recognize before your application arrives. Because when your resume lands and someone in that office already knows who you are, the process is completely different. So let's bring this full circle. The truth is this. The reason most qualified people don't get into MedTech isn't that they're underqualified. It's that they're using a general job search strategy in a very specific, relationship-driven, niche industry. Here's your 3-point framework. Speak the language. Regulatory, commercial, clinical. Position yourself clearly. Own your narrative and connect the dots. And create evidence. Something real, something specific, something that shows you're already thinking like someone who works in this space. If you want to go deeper on any of these, that's what this channel is for. Drop a comment with where you're coming from, new grad, career switcher, pharma background, and what's feeling like the biggest wall right now. I review them, and it shapes what I cover next. And if this resonated, the next video goes deeper. We're going to break down exactly how to build a MedTech market analysis from scratch, the kind that gets you noticed before you ever submit an application. No templates, no fluff, just the exact framework that works. That one drops next. Make sure you're there for it.